While they alleviated pain for a few hours, when the drugs wore off, she suffered rebound headaches.
A lot of medication overuse is simply driven by desperation. The patients don't know what else to use or what else to do.
Jane then tried several prescription medications like antidepressants, anti-seizure drugs, and heart medications, all of which have been effective in many headache sufferers, but not for Jane.
These are some of the preventive and abortive medications I've tried over the past 8 to 10 years. Sometimes I was taking one at a time, one medication at a time, although this particular one I was taking up to 7 capsules a day. Just recently I was taking 2 medications in tandem and had to add a third when they stopped working. I'm not proud of this. I would rather not be taking medication every day.
In 1993, the first class of drugs specifically designed to stop migraine pain was approved by the FDA. They are known as triptans.
The revolution in migraine really came with the advent of the first triptan drug in 1993 in this country. And all of a sudden we had something that worked specifically on migraine. It didn't just take away the pain like a pain medicine would. It didn't just cover up the pain. It actually stopped a migraine in its tracks.
Scientists believe that triptans activate receptors for serotonin, a neurotransmitter in the brain that plays an active role in the development of headache pain. The triptans reduce inflammation and shrink swollen blood vessels believed to contribute to migraine pain. Today, more than 10 million migraine sufferers, including Jane, use sumatriptan, one of 4 triptan drugs. But Jane is on a new quest. The triptans can help stop a migraine once it starts, but they can't prevent one. Jane is hoping exercise will reduce the frequency of her headaches.
With exercise, I can sometimes control the pain of a daily headache. I don't know if I'll ever get rid of them completely, but I do feel that I have more of the upper hand.
While there remains no magic bullet for migraines, Jane feels that after 15 years of suffering, she has finally gained some control over her headaches.
So Karen, you're an art therapist as well as a migraine sufferer, right?
Now, Karen Cadenhead is an award-winning artist. What makes her art unique is the inspiration for her work. It's migraine pain.
Oh, beautiful.
So,
is this yours?
Yeah, this is the picture actually that I entered in an art migraine competition.
Now look, there's a big knot in the middle.
Yeah, that pretty much explains how you feel when you've got a terrible headache.
Severe headache pain is often difficult for non-sufferers to accept, let alone understand. But for Karen, art is the ideal outlet for her to express migraine's quiet ruthlessness.
You feel like you're in this horrible little tunnel, and there's this beautiful world out here. You know, just the toe is touching this great water and bright color, and you can't get out there to experience it.
Does the art kind of take over as you're creating it?
That's the good part. You know, you wish for an alchemy, that you can take all this suffering and turn out something beautiful, something that can mean something.
Oh, well, you don't just paint and draw. I see you sculpt as well.
That's right. And since you were asking me, out of all of these sculptures, can you find which one I did when I was having a migraine?
Well, that would be easy. That would have to be this one. Right. That would have to be.
And I quit halfway through. I was in a sculpture class and the pain came on and the figure just started going limp and I had no energy to do detail.
Now, does looking at the artwork when you're having a migraine attack, does that help at all?
No. When you have a headache, you just want to be in a dark room and sleep. So, haven't you ever had a headache?
I get headaches on occasion. I don't get migraines, though. But I get a lot of stress headaches.
Do you think you'd like to try and express some of those feelings?
I can try that.
Why don't we take this head and show me how you feel when you get a tension headache. And you can add clay to it, you can poke it, you can do anything you want.
I got a better way to show you what my headaches feel like. This. That's what it feels like. Just pounding, pounding, pounding. You know, if it were only this easy to get rid of a headache.
I know, I know.
If you're an adult migraine sufferer, you know how cruel attacks can be. Throbbing pain, nausea, hours or even days of disability. Now imagine having to suffer that kind of agony when you're just a child.
I know migraine's coming on when I can sometimes hear the pounding, or I just feel sharp pains in my head. And regular headaches are just in the front, my migraine's all over.
Leah Hassan started getting headaches in elementary school. Today, at age 13, she gets disabling migraines twice a week.
When she told me about her headache, she said, "Mom, I was walking and this headache just brought me to my knees," which I thought was very rich language for a fourth grader.
I would sit in a corner or something and tell my mom, and she would just give me ibuprofen or Tylenol, but that usually didn't work because it wasn't strong enough.
Leah is among the estimated 5% of children who develop migraines.
The problem of headache in children and teenagers is really underappreciated. I have many young patients who regularly have been missing a lot of school, ending up in the nurse's office, having to skip play dates or soccer games because of severe headache. And over a lifetime, that kind of thing takes a toll. At no other time probably is it more disruptive of somebody's general development and growth than during the very busy teenage and adolescent years.
I always used to go to the nurse, and I knew I'd be missing a lot of work, and by the time that I got back there, I had no clue what was going on because I'd missed so much, and I just got really confused, and it was really hard.
Leah's mother, Marianne, understands her daughter's pain. She also has migraines, and it's likely that Leah inherited her headaches from her mother.
I feel guilty that she has them because of me. I got them from my grandmother. My mother didn't have them.
A child has a 50% chance of developing migraines if one parent suffers, and a 75% chance if both parents suffer.
Did you have any problems from the medication, any side effects?
Today, Leah is getting help. Dr. Elizabeth Loader, director of the headache management program at Spaulding Rehabilitation Hospital in Boston, has enrolled Leah in a clinical drug trial of a triptan medication for children. If the drug works, it could be the first FDA-approved drug specifically for migraines in children. Several months into the study, the drug has made a dramatic difference in Leah's life.
Leah's not the sickly one anymore. It used to be that she would just cry and want to be held.
We come to shut you!
Leah Hassan is finally free of pain and able to live out some of her childhood dreams.
I don't think Leah could have done cheerleading before her migraines were under control because the practice occurred at the time of day when she would often be crying over a headache.
It has changed my life getting my migraines under control. I am more independent and happier than before because I'm not suffering as much.
Eileen Brogan is willing to do anything to relieve her headache pain. So today, Dr. Zahid Bajwa is going to inject a purified form of a deadly neurotoxin into Eileen's forehead. The neurotoxin is called Botox, a purified form of the Clostridium botulinum bacteria. In nature, this bacteria causes botulism, a disease which can paralyze and kill its victims. But in medicine, it is proven to be a novel drug in preventing headaches.
Initially, when you bring up the idea of trying Botox injections, many patients would say, "Oh no, I'm not going to let you inject a toxin into my body." But then once you explain that it's safe, it has been around for well over a decade, and millions of patients have used it, then patients become more comfortable. No problem, no side effects from the last time we did the injections?
No.
No, everything looks pretty good.
1 year ago, I was probably working half-time because I woke up every morning with a headache.